Today we're going to talk about the 5 trauma responses that can come up in our everyday lives, how to recognize them, and where are these behaviors coming from? What is our nervous system doing during these processes? Are we in sympathetic or parasympathetic? Are we in hyper or hypoarousal? What is the fawn response? Oftentimes we'll see people pleasers have a fawn response. So they'll do anything to say yes, to keep the peace. They'll override their own needs, wants, desires in order to keep the peace and to say yes to others. They'll also feel responsible for other people's happiness. Oftentimes the fawn response can come up as a result of having had to keep other people happy in order for them not to become abusive or neglectful towards us. And so it was our survival response to keep the other people around us happy in order to keep ourselves safe. And the downside, among many, to that is that we forget how to detect what we want, what we like, what makes us happy, what we need, and even how we feel. And so that is a little bit about the fawn response. The fight response. We'll see people have a fight response when they're always suspicious of other people. They're always on guard. And when people tell them something fairly neutral, they'll take it as an attack and they'll respond as if what they took in was an attack. So even if you say, I noticed you're wearing blue today, they might take that as, you think that blue is a bad color, or whatever it is, right? So you say something fairly neutral and it comes up with a very hostile, defensive, aggressive response because they took that neutral comment as an attack. So it's really a lack of trust, it's being on guard, it's being suspicious. And in order to make them feel a little bit safer, they feel a need to control environments or to control others in order to feel more empowered and to feel more trusting, in some way. And so that is how the fight response can come up in everyday life. How does the flight response come up in everyday life? The flight response comes up in a few different ways. I know someone that literally just runs in order to avoid what they don't want to face. And so they will run for 6 hours, and so, well, that is definitely the flight response and they know it. And so we can be aware of our flight responses. And other ways that the flight response happens that are a little bit more subtle is when we use avoidance, when we use distraction, or when we have impulsive behaviors that actually put our safety at risk, such as speeding or such as being unsafe in some ways because we want to get completely lost in a distractive activity that will take our entire being and mind off of something. Oftentimes when we have this flight response, it is a very painful way to live, always needing to escape into something else, because when we don't escape and when we just sit with whatever we are feeling and that pain or that grief or that loss or that anger or that rage, whatever it is, it's a painful thing to sit with. And so it's literally living in flight of that. Then we have the freeze response. The freeze response results in high blood pressure, high heart rate, high sympathetic arousal, and dilated pupils. So we have someone that will fight or run as soon as they get the chance to, like an animal that has been cornered. Okay, so that's the freeze response, where they're literally frozen and they're stiff as a stone. We'll often see that we can't take nice deep breaths, or that we're holding a lot in our muscles and in our body, or clenching our fists, or just feeling, like we can't take up space, we can't breathe. It's very much in an immobile, frozen, stiff state that's even affecting our muscles and our respiratory muscles. And then we have a shutdown response. A shutdown response is an extreme response. So think of an animal going numb and going limp in order to play dead. And that's not actually their choice. It's just a physiological response where their body allows their muscles to go limp and allows them to physiologically prepare for injury. So that's low blood pressure, low heart rate, protecting them from, potential hemorrhage, from bleeding out. It's also an increase of endogenous endorphins. So it's the body's natural endorphins that are released, which can be a internal physiological pain control, right, for that moment or for that short amount of time. Unfortunately, this often comes up when people are cutting themselves. So they're put into this state where these endorphins almost numb the pain. And as we are existing in this state, it's really not that conscious. So it's not being aware of what's going on inside of our bodies, outside of our bodies. It's dissociation. It's feeling almost like we are the fly on the wall that's observing ourselves from above. So it's a really dissociated state to be in. So obviously, all of these reactions that come up in our day-to-day lives or during extreme responses as well have so many nuances, and there's so many more that we can talk about, but I did want to make a short little video just to help us understand what are some trauma responses and how we can notice when they do come up. Thanks for joining me today.